So my name is Stephanie Newton and I'm a homeopath, and you can find my practice at stephanienewtonhomeopathy.com. The purpose of this video is actually for my current clients who are under homeopathic care at this time, and the purpose of the video mainly is for patient education so that they can better understand the process of homeopathy, what healing looks like, how to dose at home, and all those types of things. If you're not one of my patients, you might get some benefit from this video as well. So what does healing look like long term? So with homeopathy, homeopathy is stimulating the body to heal itself. So this can look very different for every single person, and we can't exactly predict the steps involved in that path toward healing, but there's a general progression that I can explain now. So the first thing I want to show you guys is sort of a little bell-shaped curve, and I'm not sure if this is going to show up. Well, I'll hold that up in a second. So as you know, during your first prescription, you're given one or more constitutional remedies. Sometimes I'll give two so that we can see which one works better, or we might even keep both on board. And sometimes there's also a nosode or something like that. But basically what I'm talking about mainly here is the constitutional remedy and sort of the progression of that. So when you're given a constitutional remedy, your symptoms will kind of, the effectiveness of the remedy will kind of start at the bottom, and it will slowly increase until it reaches like a peak. And that can happen within a few days, within a couple weeks. So generally what happens is you take the remedy, you notice several different reactions, which I'll explain in a moment, but this is basically showing you the improvement. And what's happening is, as you're taking the remedy, I am slowly increasing the frequency at which you take the remedy, and I'm also increasing the potency sometimes, and that's what pushes the remedy to push the body to heal itself. Now, once the remedy has done all it can do, it reaches the top of this kind of curve. And at this point, you'll notice a really nice improvement in symptoms. Now, if you've come to me with 25 symptoms, there may only be a couple that are affected. Usually, if it's a good remedy, usually it's going to be the most limiting symptoms or the most severe symptoms that are affected the most. Those are usually the ones that are going to go first. Now, what you consider severe and what your body, your vital force considers severe might be different. So we can't dictate to the remedy and to our vital force what we want to go first. It's going to be, our body and our vital force has its own intelligence, and it knows what to do first, and that's what's going to happen. So you'll notice an improvement of certain symptoms. At this point, you'll notice that each time you give the remedy, we're kind of going down the curve now. Each time you give the remedy, it's just not quite having the same bang that the other remedies were having. So normally when you take a remedy, you notice this nice improvement, and it stays that way for a few days, and then you notice the symptoms starting to come back, and that's when the next dose usually is scheduled to occur. When we're going down the curve, we're noticing that, well, each time I give the remedy, it's not quite having the same effect. And it doesn't necessarily mean that you're losing the gains that you achieved, but you're just kind of not progressing. You might be losing some gains, but usually the gains that you've gotten, so let's say again, you came to me with like 10 symptoms and 2 of the symptoms were very much impacted. The gains that you've gotten probably are gonna stay there, but you're just kind of like stuck, like you're not moving forward anymore. So at this point, this is when, I'm trying to hold this so you can see it, this is when the next constitutional remedy should be coming into the picture before it really starts to drop a lot. So you kind of want the next constitutional remedy to be coming into the picture about here when you do hit that plateau. So the next constitutional remedy is given at the next full follow-up. So, in between follow-ups, I normally talk to patients, whether it be on video, chat, or phone, and I adjust dosaging. I adjust the frequency at which you take the remedy, and I also adjust the potency sometimes. But it's the full follow-up appointment, usually about 6 weeks after starting the remedies, that I will then change the constitutional remedy, because usually we're noticing by then that we're kind of going down this bell-shaped curve. Or we've plateaued. So the next constitutional remedy comes in, and you'll notice a little bit more of a peak in your health. You're getting a little higher. You're getting more gains. Maybe more symptoms are being impacted, or maybe the first symptoms that were impacted are being impacted even more, and you'll notice more of a peak. So the next peak is a little bit higher, and then same thing, maybe after about 6 to 8 weeks, you'll notice this remedy just isn't packing the same punch when I give it anymore, and maybe I even have some new symptoms that have come up and some old symptoms that are coming back, and things are kind of shifting, and this remedy just doesn't seem to be the constitutional remedy for me anymore. Same thing, this is when you want to have a full follow-up so that I can then give you the next constitutional remedy. And again, the next constitutional remedy should get you to a higher peak in your health, etc. And then we keep going and we get to a higher peak. Now this process there are people that are so aligned to begin the healing process that the first remedy could be all that they need. It could be all that they need ever, or it could be all that they need for maybe the next 6 months. They just don't need a remedy after what this first one has done. They're just good, they're fine. And then 6 months later, a year later, they might realize, I'm kind of experiencing these other symptoms and I need to come back. So, when I say 6 weeks between full follow-ups, this is for people who, I tend to see patients who have autoimmune illness and autism and different special needs. And usually their pathology is pretty deep and pretty complex. And there are many, many layers that need to be uncovered. And so for those people, to give you an example, for my oldest son, I would say that the process took about 5 years. Now that doesn't mean we didn't get really big benefits in the beginning, but to really get on top of everything that he brought to the table, which was about 25 different chronic illnesses. He was very, very complex and sick. The process was about 5 years. Now, when he was being treated, he wasn't being, I didn't go back for my appointments every 6 weeks. I went back like every 4 to 6 months. That was just my choice. I just went slower. I could have gone faster, and possibly the whole process would have been condensed. So that's just kind of up to you and how quickly you want to move through the layers and reach the higher peaks, etc. So healing takes varying amounts of time, and it just depends on the patient and things like that. It also depends on the environment in which the person lives. If the person lives underneath a huge set of power lines, something crazy like that, or they're being exposed to lead on the walls daily, or there's a lot of emotional tension in the home, they're going to need more support, okay? They're going to need probably more frequent dosing. It might take longer for that person to progress through the remedies. It might take a shift in the emotional environment for the person to really reach their maximum potential in healing. So what else do I want to say about that? Okay, so as you're healing, what you'll notice is that symptoms are moving from the mental and emotional plane to the physical plane. This is the way our body and our vital force tends to heal itself. So let's say, for example, you're an adult and you're experiencing brain fog and like some ADD, and you're not focusing, you can't seem to get your words out, that kind of thing. Ideally, what you'll see is those symptoms improving pretty dramatically. However, then all of a sudden you might have this skin rash. You might have some body aches. You might have maybe some digestive issues, and that can be temporary as symptoms are being pushed out. or it can be a whole new constitution is developing. So at first, when you came to see me, your constitution was more on this mental brain fog, ADD, and now all of a sudden, wow, that's better, but I've got all these little like aches and pains and ailments and things like that. And the next time you come to me, we're talking more about that. And that's what the next constitutional remedy is going to target. So something else you may notice as mental symptoms are seeming to clear up, you may become more emotional, or your child may become more emotional. So as your child is engaging more, they may all of a sudden become more emotional. And this is sort of, again, a detox of symptoms. It's also, or a detox of emotions. It's also kind of a shift of symptoms. So next time we talk, when it's time to choose the new constitutional remedies, instead of the main focus being, my child is not engaged or my child can't focus, it might be, my child is so sensitive. He cries over, the silliest things, but he's more engaged and he's more focused. And so, again, the symptoms are moving from mental to emotional to physical. So we know that the symptoms are moving in the right direction. We're just not there yet, and we will get there. Okay, so the next thing I want to talk about is what type of a reaction will you see with your remedies? So when you take your first remedy, what's going to happen? You can see an immediate improvement. This can look like having more energy, just feeling more positive, having a greater sense of well-being. You could also experience what's called an aggravation, which is a temporary increase in the current symptoms. So to give you an example, when I took my first constitutional remedy, I became very angry for 10 minutes. I just felt extremely angry, and things were coming up from my past in my mind that I was angry about, probably things I had suppressed. And then after that, that went away and I just felt better. I had this feeling of well-being. I also experienced dreams for 3 nights, nightmares about things from my childhood, believe it or not. But during the day, I felt amazing. It was as if things were coming up from my subconscious. They were being addressed and released. So that's sort of a typical thing that can happen. Now that's as an adult. For a child, especially the patient population that I see, an aggravation of symptoms might be if the child presented with rage. He might have a rage for 5 minutes. But probably not, to be honest, because I dosed the remedies so specifically to not push too much of an aggravation, especially for a situation like that. However, you could see the child become angry for a few minutes and then all of a sudden kind of calm down. What else could it be? If the person came to me and their main complaint was gastrointestinal side effects, they might, or gastrointestinal symptoms, they might have diarrhea for a whole day. Or a person might, let's say they have, aches. They've come to me with joint pain. The joint pain might get a little bit worse for a day. And then the next day you notice a nice relief. So a gain above baseline. Another thing that is pretty common is a detox of symptoms. Now this may not happen with the first remedy or the first dose, but at some point, if the patient is a complex patient especially, there's going to be a detox of symptoms. And especially if there's been a lot of suppression in the history with the use of antibiotics and steroids and things like that. So these bacteria or viruses or whatever that have been kind of suppressed and are kind of hanging out dormant in our system and haven't really been properly dealt with by the immune system, now all of a sudden you give the body and the vital force this spark of energy with this constitutional remedy, and it starts cleaning house. The cleaning house can be a little bit uncomfortable. It can be frequent urination. It can be diarrhea. It can be a runny nose. It can be a little bit of a cough. It can be fatigue, like, oh, I have to go take a nap. Go and take that nap. Your body is telling you what to do. Your body is cleaning house. It's detoxing. It's getting rid of the things you no longer need or should have had to begin with so that you can start experiencing true health. So an aggravation and or a detox can occur. And something that can really help kind of facilitate this process and move it along, make it a little more smooth, is called an aggravation zapper. And this is a way to redose the remedy in a more diluted form. I'm not going to go into the instructions here, but you can go to Google, type in aggravation zapper, and probably the first link that comes up you want to click on, and it gives you instructions on how to do an aggravation zapper. This helps to bring down the aggravation and possibly move through the detox symptoms a little bit quicker without canceling out the gains. It's a beautiful, beautiful way to deal with an aggravation. Another thing that could happen is a proving. Now, this is very rare for this to happen. A proving would be a symptom that occurs that you've never had before. It's just this strange symptom that happens, and you report it to your homeopath, and he or she says, oh, that's a symptom that's part of that remedy. It's approving, and we need to stop your remedy, or we need to decrease it. Now, provings can be strong or they can be very mild. If the patient is experiencing really good gains, but then they have this real small proving symptom, it's probably okay, but check with the homeopath, check with me to make sure that it's okay to keep reducing the remedy. A shift, so those are kind of short-term things that you can see with dosing of remedies. Long-term, you can see a shift of symptoms, as I've said, from the mental and emotional to the physical. So I'm going to give you an example with my youngest child. When he presented with autistic features, he would not socialize with people outside of our home, not even like my brother and family. He would bury his head in my chest. He would scream no. He would want to go home. And he wasn't extremely engaged at home, but he was much more engaged at home than he was outside of our home. So that presented as sort of autistic. Maybe you would want to call it social anxiety, whatever we call it, that's what he had. And as those symptoms went away, so he started engaging with people outside of the home, to the relief of a lot of people that we knew. However, he developed asthma. So he actually developed a new chronic illness. The reason this happened is because we happen to have asthma and allergies in the family. So it's a genetic predisposition that he had. And as his autistic features, which are more mental and emotional, went away, it shifted the symptoms out to the physical. Now, the way I like to explain this is when we experience stress, whether it be mental and emotional stress or environmental stress of any kind, we react with some sort of pathology a lot of times. So what we want is for our body to react more on the physical level. We don't want to react on the mental and emotional level because that's very debilitating to our ability to live out our life purpose on this earth. So according to homeopathic philosophy, it is best when the body expresses symptoms on the physical level. So that's what was happening with my son. He wasn't expressing his pathology on the mental and emotional level anymore. He was expressing it in his lungs. Asthma is not a fun disease to live with, so it was not an easy path. However, we shifted his constitutional remedies. At one point, we ended up doing a vaccine clear, and the severity of the asthma reduced about 85 to 90%. So now it is something that comes back every once in a while if he's got really bad bronchitis or something, and we don't have to go to the ER. It's not severe, but he's kind of just fallen into that family predisposition. I had asthma as well. I still carry my inhaler in case I'm ever so stressed that I have an asthma attack, So that's what can happen. Symptoms can move from the mental and emotional level to the physical level. And best case scenario, we can then focus on those symptoms and move that out even further, or get you to a place of perfect health. I can tell you that at age 43, I'm at a place of perfect health. However, when I experience a lot of stress and I'm kind of moving in a direction I shouldn't be moving in my life, I experience thyroid symptoms. So I get cold, I get tired, I might put on a little bit of weight, that kind of thing. So that's kind of my barometer to let me know I'm going in the wrong direction, something in my life has to change. And then those thyroid symptoms go away. So something else that may happen during the progression of healing is an old symptom may come back. So for example, let's say after like a month or two, you come to me and you say, hey, you know, my son used to be afraid of dogs. And like when he was 5 years old, and now all of a sudden he's afraid of dogs again. Or he's just got this some former anxiety that has come back, you know, not like real high, like we're not back to baseline anxiety, but it's like just this old kind of strange symptom. And it normally doesn't come back as strong as when the person first experienced the symptom. It's just kind of like an echo from the past coming back to be addressed. On some level, I don't quite understand why some of those strange things come back. Some things make more sense, such as, you know, I had this knee problem in my joint years ago, and all of a sudden my knee is kind of bothering me a little again. And usually it's not anything that really bothers the person. It's just something they mention they find strange. And that's the body, again, kind of cleaning house, kind of dealing with something that was never fully dealt with. It's also, again, the symptoms moving from the mental and emotional to the physical level. So it's part of that process of pushing symptoms out to the physical plane or the emotional plane and then back out to the physical plane. And then, you know, another reaction that could happen is nothing. Nothing happens with your constitutional remedy. So some reasons for that would be, you know, either just I or your homeopath was just way off and didn't pick the right one. But to be honest, that's normally not the case. Normally with an experienced homeopath who most of the time hits the mark, if the homeopath is not hitting the mark on you for some reason, there's probably something that needs to be cleared. So I can give you an example with my son. My youngest didn't respond as quickly as the oldest, and that's because he had an active strep infection at the time, and no antibiotic would clear it up. We tried every herb, everything. Every time we went back, he had a strep infection. And I mean, the doctor just shook his head and said, like, I don't even know what to do, you know, besides remove the tonsils. And I wasn't going to do that because I was about to start homeopathy. So we had to, you know, that illness, infection had to be addressed directly by the homeopathy. And as that infection cleared up, then his constitutional remedies started to work. But there could be some sort of a block, and your homeopath has been trained to look for blocks. This could also be something like, you know, you took steroids 5 years ago, and we need to kind of detox that steroid. Okay, so something like that could help your constitutional remedy then to start working. Another example could be you got into a car accident and you experienced a concussion 10 years ago. It could be that we need to give you a remedy such as arnica, which would actually be given at the time of the concussion, but now it needs to be given 10 years later just to kind of clear that trauma in order for the constitutional remedy to start working. So there's many different reasons and many types of blocks that could be occurring that need to be cleared before that constitutional remedy is able to, you know, move through and do its thing. Okay, dosing. The next thing I want to talk about is dosing. So this is very important for my patients who are at the point where they want to start to be able to dose their own child or themselves without having to check in with me every 2 weeks to kind of tweak the dosing. So with homeopathy, it's not like going to an integrative doctor where they say, you're low in magnesium, I need you to take this amount of magnesium for the next 6 months, you know, 250 milligrams every single day for the next 6 months. Homeopathy is almost never dosed that way. It's a constantly evolving thing. It's energy medicine. So, it evolves because once the potency does what it needs to do, you need to go to the next potency, or you need to take it more frequently. Or maybe there's some emotional event that happened in your life, and now we need to increase the potency sooner than we thought we would, or something, or maybe we even need to switch it to another remedy, but that's another story. So homeopathy is a constantly evolving process, and this is why in the beginning with my more complex patients, I change the dosing every 2 weeks so that we don't have like a stale protocol and we're moving forward, okay? So, but I can't change the dosing every 2 weeks for every patient that I have in my caseload. So eventually a patient has to start dosing it themselves. So this is, I'm just going to give you a quick dosing training. So this is what, I wouldn't call this a typical situation, but basically, I'm just going to kind of try to give you an idea. I don't know if you can see this very well, but let's say you start out at a 30C and I tell you to take it twice per week, okay? After a couple of weeks, that's not quite enough anymore. It's like you need a little more of a punch. So the next 2 weeks, I'll probably tell you to take it 30C potency 4 times per week. Okay, so we've increased the frequency, and then you're feeling better and you're moving forward again. Maybe 2 weeks later, I tell you okay, time to bump it up to 200C, the 200C potency. Now, since we've gone up in potency, we're probably going to go down in frequency. So 200C potency once per week. And then a couple of weeks later, it might be 200C potency 3 times per week. So we're not changing the potency yet, but we're changing the frequency. And then maybe 1M potency once per week for 1 week, so 1 dose. And then maybe we need to go to the 10M potency, 1 dose. Okay, so once you get up into these higher potencies, you're going to need less doses in order for it to do all it can do. So when you're at like a 1M and a 10M, you don't want to keep redosing this. You could really push the vital force in a different direction that we don't want it to go. So once you notice that these potencies, once you get up to like the higher potencies and the higher frequencies, and you notice, I don't really think this is doing the same thing. Something seems to have really shifted. Maybe the constitution is totally different. Maybe, maybe it's even causing some weird aggravation or proving. Like, you want to stop dosing right away if anything like that happens, and check with your homeopath. It's probably that the remedy has done all it can do. But the point here, in order to kind of help you to learn how to dose yourself, so this is what I want to get to. Let's say, frequently I'll start a patient on a 30C or a 200C potency. And I'll say, take it twice a week for a couple weeks. And then you'll check back in and I'll change it to take it 4 times per week for a couple weeks. Okay, and then let's say you're kind of on your own at that point. Let's say that it's not time for new constitutional remedies. You can tell that this remedy is still doing something for you or for your child, but you're on your own. You're past like the 6 to 8 weeks of care that I provide, and you don't want to make a follow-up consultation yet because you don't feel that new remedies are needed, but you want to keep dosing the remedy. So what do? Okay, so let's say that you left off at a 200C potency 3 times per week. Actually, I'm going to go back. Let's say it was 200C potency 1 time per week. That's the last set of instructions I gave you. So that's good for 2 or 3 weeks. After that, you want to start using it as needed only. So you want to wait until the symptoms come back and you think to yourself, I think that my child could use another dose of this remedy. You give a couple drops and you wait. You see an improvement, maybe you see a plateau, that's fine. Maybe you see a little decrease of well-being, and you think, okay, I think he needs another dose of the 200C potency. And you give it again and you notice an improvement. Great. You keep going just like that. So you're not giving it on schedule, you're giving it as needed. Now let's say you're doing that and you notice that it's just not having the same effect. So at this point, it's either time, now you're gonna kind of have to judge, has the constitution changed? Have other symptoms kind of risen up to be dealt with? Or is it just not seeming that powerful enough anymore? The dose just doesn't seem powerful enough. At that point, it may be time to go up to the next potency, which is 1M. So now maybe you've switched to the 1M potency. And once you do this, again, you're going to use it as needed, but there's a chance that the patient, the child, or yourself only needs 1 dose in total. So you have to be very careful. You dose it and you watch very carefully. If you notice that the constitution, again, is changing, it's kind of shifting to a new symptom picture, you don't want to keep dosing the 1M potency. If you do, it's not necessarily going to hurt, but it's going to be uncomfortable. So I'm going to give you an example back when I was being treated. I kept dosing my first constitutional for a long time. I didn't quite understand how this all worked. And I kept dosing it past the expiration date, I like to say. And what happened is I became very debilitated physically. I developed, things got pushed to the physical plane really strong. Like I couldn't get out of bed. I was so exhausted, and it was actually my thyroid symptoms, but they were so strong. It was like every time I dosed that old homeopathic remedy, it pushed it harder and harder, and it made those physical symptoms more and more debilitating. So, you can kind of, basically what was happening is that old constitutional remedy was pushing me more deeply into that next constitution, that next set of symptoms. Now, this is not a terrible thing. It actually makes it very obvious to the patient and the homeopath what the next constitution looks like. It's like, wow, this symptom's really big and this symptom's really big, and we know exactly what to give. So in some ways that can actually really bring things up really strong so that we know what to do next, but it's uncomfortable. So if you notice that your constitutional remedy, you're at like 1M potency, or this can even happen at a 200C potency, or even a 30C potency. You notice that it's just rising symptoms up that, are kind of not new, but they're kind of other symptoms that have come to the surface, and these other symptoms have gone away, but now we've got like this new thing. Stop giving the remedy. It's time for a new constitutional remedy. But if you let's go back, if you're on the 1M potency, let's say you've moved up in potency and you notice a really nice effect from that dose, then it's probably going to work again. Let's say 10 days later, you notice, I feel like I need another dose of that. You can go ahead and give another dose of that. But if you get to a point where, oh, it didn't have the same effect as it did last time I took it, maybe it had a little effect, that's good. If it had almost no effect, you're probably moving into a new constitution. And to give another dose, you might be getting into that uncomfortable zone. So, and again, if you dose yourself a 10M potency, which I really don't recommend, you probably only need 1 dose of that. Unless, again, for some reason that 10M potency does something really magical for you, and then 10 days, 2 weeks later, you notice all the symptoms coming back and you just instinctively feel like it's time for a new dose, then go ahead and do that. Another tool that I like to pass on to parents is energetic testing. And I don't teach energetic testing, but it's something you can use. So that would be muscle testing, sway testing. You can email me and I can send you a link to a video that I suggest watching to learn your own energetic testing, so that when you're not sure which potency and whether or not it's time for a new dose, you can test yourself and find out if that resonates with you. Or you can find a local practitioner in the community who can do the muscle testing for you and help you determine which potency, how frequently, stuff like that. So I hope that this helps, and I just wanted to be able to empower my patients to kind of understand what's happening and be able to redose on their own if necessary, so that you're not so reliant on me to change up the protocol. And at some point you might get to a point where you can manage your case for a few months without having a follow-up consultation with me. So that's the goal here. And thank you again for watching. And if you need to contact me and you're not one of my patients, you can find me at stephanienewtonhomeopathy.com. Thank you.